Hi everyone. My name is Vic. I'm a new CDTRP trainee. I'd like to thank Chelsea and Leanne for inviting me to um, introduce the speaker at the talk today. I was also told to just give a quick introduction to myself. So I'm currently a kidney transplant fellow at UHN. And my plan after that is I'm going to be embarking on a PhD degree under the supervision of Dr. David Cherney, who's a nephrologist also at UHN, as well as involvement with Dr. Suniti Singh, who's a transplant nephrologist at UHN. My interests are looking at mechanistic and clinical trials, focusing on cardiorenal protection in the diabetes population and the transplant population specifically. So I'm looking forward to that. I'd also like to, I hope that everyone is safe with everything that's going on right now. With that, I will proceed to introduce Dr. Yeates. So Dr. Yeates is a professor of medicine at Queen's University in the Faculty of Health Sciences. She's a graduate of McGill University and subsequently Queen's University School of Medicine. She currently directs a program of global health implementation science research in Tanzania with collaborative projects in Kenya and Ghana. Dr. Yeates is considered a global leader in the development of mobile health interventions to improve detection and management of non-communicable diseases. As an M-Health researcher and an expert in developing mobile health tools to support task shifting and task sharing among health workers in resource-poor settings, she has developed broad global collaborations in a variety of domains of healthcare, including detection and management of preeclampsia by non-physician health providers in remote and rural Tanzania, and M-Health programs in acute kidney injury in collaboration with the 0 by 25 global program of the International Society of Nephrology. She has served as a global educational ambassador for the International Society of Nephrology for more than 10 years and has trained and mentored numerous graduate students and numerous medical trainings in LMICs in developing nephrology research, training, and health service delivery programs. She has conducted research in access to kidney transplantation among Indigenous Canadians, and she has managed the kidney care and dialysis program on the James Bay coast of Ontario in the Weenie-Bayco Health Authority for more than 15 years. Over the past 8 years, her global research program has been funded with over $8 million in grants from peer-reviewed agencies, including the CIHR, Grand Challenges Canada, International Development Research Centre of Canada, and the Wellcome Trust. She was inducted as a fellow in 2017 into the College of New Scholars, Scientists, and Artists of Canada. Thank you.
Thank you very much for that. Sorry, everybody. I'll just get started here, and I want to give you all my sincere apologies for the previously scheduled webinar, which I got stuck in an airport in Kenya and didn't get to my hotel in time to be able to give it to you. So I do apologize for that and for the inconvenience. I know you're all very, very busy people. So you can see the topic there of this discussion. And I think as Chelsea said, I'm happy to have you ask questions anywhere at all through this. And we can stop then, or we can save the questions for the discussion at the end. And I also apologize because I'm working from home because I have to go on service on Monday, and we've been instructed to stay away from the hospital and even our research offices so we don't get exposed to anything that might let us not be able to work in Kingston at Queen's. So I've got 3 teenagers at home and 3 dogs who are now locked in the basement. So I apologize if it gets a bit noisy. So the objectives here are, these are just ones I set out, and of course I'm happy to talk about any other topics related to these at the end that I may not have thought of, but to review what the research priorities are for Indigenous people, because I think it's important for us to, I think that's probably not the only, but one of the most important populations that we need to be considering. as health researchers. Of course, many of these communities are rural and remote, but that's not to exclude other Canadians who live rurally and remotely, who also have lots of health-related burdens that certainly would be worthy of well done and impactful research. We want to examine ways to set research priorities, and how do they align with your own will be one of the considerations. Explore and review the roles and responsibilities of the health researcher, and learn a little bit about participatory approaches to research. I'm going to just brush over that because that is a whole area that would require multiple webinars to learn about, but I just want to make sure that everybody sort of knew what that concept was. So we hear a lot about knowledge translation. Any of you who are writing CIHR grants know that this is a Canadian specialty, and it's important. It's what we used to call dissemination, but knowledge translation takes on a much bigger role as an entity. And certainly how we translate our research findings in any field and anything you're working on can be a challenge, but for sure it's a big consideration when we think about setting research priorities and what the outputs of those research programs would be among Indigenous peoples, communities, and in rural and remote living Canadians. Because a lot of what we're exposed to is really the evidence that arises from clinical trials that we might see in large teaching hospitals, or even large community-based trials. And sometimes we know from a pragmatic perspective that how those outcomes were generated and those research outputs and evidence were generated from those trials may not always be easily transferable to remote, rural, and disadvantaged populations. And these are things you need to consider right at the very beginning when you're thinking about what research you might want to be doing and how you set those priorities, and certainly how you might design your research program and the delivery of your intervention or interventions can be quite complex. We also need to think about Canada from a geographic context. It's a huge country in terms of land mass, and certainly when we consider remote, rural populations, they are scattered across the country, and there really is a lot of unique problems we have to think about, not only from the health burden in terms of health disparities and what research priorities we might be considering, but also problems, unique challenges, I would say, not problems, with respect to how we might deliver, how we might develop a research program and deliver it. One of the things I wanted to for sure mention is the concept of parachuting. Parachuting in to these communities is something that we needs to be first and foremost in our minds as researchers, and because this has been done, we have our historical forefathers and foremothers to consider, because this was really the historic model of how much health research was done among Indigenous populations and in all many rural and remote communities, many of whom happen to be Indigenous. And things to consider with this are the timing of your engagement with communities and different populations in these contexts. Your involvement with the community, what's your historical involvement, maybe as a health provider or as a researcher. And you have to deal with the contextual history of previous researchers involved in those communities and what that engagement was and how positive or negative it was. Thing I call distraction of energies and resources. So what may be something that you feel like that is actually a very important research priority and something that you want to try to engage a community in taking part in, may distract a community from other very important things that are important for the life and health of the community. And this is something to consider. And it could be that many of the things that that you think are important and are important just are not important at that time, and really impossible perhaps for those communities to take on, whether they're Indigenous or not. Just thinking about the challenges of very remote and rural communities. The other thing to think about is the ethical frameworks that you come through with your research program and ideas to individuals in a community and the community as a whole, and how those communities work and their linkages and their social networks and social fabric, and whether you're speaking to an individual or the community. What I mean to say by that is many times you're speaking to the community as a group of individuals, and you're not just speaking towards the individuals within a community, because the community works in an intricate way of hierarchies and decision makers. You have to think about the interpretation of your results, not just your interpretation, but the community's interpretation, and how the results may be interpreted by the health research community or the people who make guidelines and things like that, and how so how you translate the knowledge of what you've learned is important. And then of course comes up as I said, the translation, but the dissemination. And Canada is, as I said, diverse and large, and we need to think about the fact that approximately 1/5 of the Canadian population is spread over 95% of Canada's whole land mass or territory of land that we have as a country. It's incredibly diverse from rural region to rural region, and demographically, economically, and culturally, of course, very diverse. And, you know, you need to think about research you may be doing in rural and remote communities or Indigenous communities, and the generalizability of that back to the general population, and or to other communities who are rural and remote. And certainly these are considerations that you have to think about when you're writing a grant. You have to think about what the peer reviewers are going to be thinking, but also it's thinking about resources. Like research money is a finite, precious resource, and it's getting thinner and thinner as time goes on, as we have competed, and we have many competing health priorities and health research priorities. And you have to think about how you're framing the work that you're doing, and is this something that you want to spend your taxpayer dollars and my taxpayer dollars and everyone's taxpayer dollars on, and how you can design your program and in a way that is most impactful. And along those lines, there's a really pressing, important need for research to be designed that is impactful. We don't need any more. We need very few more epidemiological studies. We know what the health burdens are. We know where the gaps are. We know what a lot of the health disparities are. But at the same time, you know, how you plan your research program or your whatever you may be pursuing, it's, you know, you're a steward of that funding and of the relationships you have with these communities for your researchers who will come after you. And you want to do things properly and ethically, and you want to have the greatest impact be able to have the greatest impact for the energy and the time and the work that you're going to do, and for subsequent researchers as well. And you have to think about not only addressing quality gaps and health disparities, but you know, how are you going to do that? You know, you're going to be thinking perhaps about determinants of health, which are complex and multi-level. You need to think about maybe improving service delivery across diverse communities. So we can be very single-minded as researchers. That comes with the job. Many of us are type A, but sometimes you have to put on a different hat. And think about upstream and downstream effects of what you're planning to do. Unintended consequences is very important, and with that can come wonderfully positive unintended consequences about things that we didn't even know about, as long as you're coming in with an open mind and thinking sometimes a little differently than you would in a clinical trial setting that's controlled in a large academic health center. When you're thinking about developing research that's impactful, you have to, as I said, think about, you know, resource constraints. Not only as you think about, okay, I have this pot of money and I want to do this research program, but you also have to think about, like, beyond the research, could this intervention, if it was wonderfully successful, ever be implemented in a reasonable, cost-effective way in that whatever context or setting that is that you're thinking about? you know, speaking, if I'm saying mostly this is all about rural and remote communities or Indigenous communities. But we do think about this with all of the research that we do. We should be, but it's particularly important when you think about translating the evidence and how could this be pragmatically implemented on a larger scale feasibly, even if it was the best cure in the world, you know. And you have to think about things about historical distrust. So this is real, and it exists, I would say, primarily here. I'm speaking about our Indigenous peoples, First Nations communities, where a lot of distrust has exists now and has existed in the past because of the way that research was carried out, and this long legacy of colonization and research, very, what I would say, abusive research history among our Indigenous peoples. And so I'm going to touch a little bit here on community-based. Well, I like to call it community-based because I think of anywhere I'm working in the world, I work in communities, and I tend to call it that versus participatory research. But really what you're getting at is the engagement of the people with whom you are planning to do the research on and with. And it's not research on, it's really with, right? And how will you design your program with the inputs and the considerations for all of these stakeholders in mind. And really the goal is to foster sustainable efforts at the local level to facilitate the translation of research advances into the improved health for all, not just the community, but in other communities like those communities and beyond the communities, and also to enhance the ability of individuals and communities to address their own health needs and health disparities. And I took that right out of a Canadian family physician article, which I felt was a really nice, good read around thinking about community-based research. So how are you asking the questions, right? So this is really just getting at the idea that, you know, what you think you're asking may seem appropriate to the community, and they may say, yes, we need this research, this is a priority here, but all through the development of your research model, your program, whatever framework you're working in, whether it's delivery of a health intervention or a medication, or it's something working on a health training of health providers and how they are going to deliver an evidence-based intervention, if you will. You always have to be aware of the fact that as you set you've got your set priorities of what you want to do, but the way you're developing your research, if you don't have a lot of input from stakeholders, you think the questions that you're actually asking are the exact questions, but the way that they're perceived in terms of the answers that you're looking for may not actually be the right answers. Now, that's a bit esoteric, but and you can look at it multiple different ways, but it's kind of that garbage in, garbage out phenomena. And researchers can put themselves at real risk if they do not fully engage, especially for community-based research, which could be within a hospital in a community or within family practices or in specialty clinics. But you really can drive your research to get what you want, which is what you think you want, but it may not actually be the exact answers that really are what's needed. And just thinking a little bit about, sorry about the messiness of this, I couldn't pull it off the Stats Canada website for some reason, so I had to go find it on Pinterest. But this was just to speak to what we may perceive. I know I have a broad audience here, but excuse the typo there too. I was quickly adding it in because the other one wasn't good quality. But what we think are health research priorities are real. Like, there are real priorities. You know, for me as a nephrologist, you know, and as someone who does kidney transplant as well, you know, we just see the tsunami of chronic disease coming down the pike from our First Nations communities. I've worked up in James Bay for many years. I run the dialysis unit up there. We've had many people been transplanted from up there, with various challenges along the way. And, you know, for me, I see chronic conditions as a major priority. And I'm constantly thinking about how I can engage with communities up the coast to provide better healthcare. I just spoke to a colleague in BC the other day about a beautiful app he's built where he's deploying across Africa to help public health officials there track COVID-19. And he asked if I could introduce him to the public health people that I know in Tanzania. And so he demoed it for me. And I said, wow, this would be amazing for me to use to help engage people up the James Bay coast to help them manage their blood pressure better. And, you know, so that's a priority that's in my mind, but it may not be the exact priority that the community has. This is just another example off the StatsCan website to give you an idea of, this is 2012 data, but it looks at First Nations populations, men and women by age group, and looks at chronic conditions, and you can see them across the board there. But you know, I picked this because it includes mood disorders, you know, which most common are anxiety and depression. But you can go through the StatsCan website and look at statistics for rural and remote people, non-Indigenous or Indigenous, and you'll see that there's a heck of a lot of other priorities out there that are probably just as important. And so this is just to get at the fact that when you go to a community or a group of communities with research, with a wonderful research idea, it just may not be what they think is important. And that will really affect your ability to engage all your stakeholders and to successfully implement your research program. So I put this up here. Your priorities may not be the communities. This is straight off StatsCan as well, looking at, you know, other social determinants, physical environments, right? People whose homes are in need of repair, who have at least one chronic condition. This is a health condition, right? This is the survey, Aboriginal people survey from 2012, and people were asked to self-rate, you know, whether they felt their health was fair or poor, and their general health, mental health, and based on their chronic conditions. And then it looks at their other determinants. Their houses are in need of repairs, or they've had to move, or you can look at, see who has food insecurity, who's homeless, how many people live in one house, do they have running water? You can see how your priorities may quickly be pushed down to the bottom of what they may feel are really important things that need to be dealt with. So I wanted to touch on this really important document. So this is from the Institute of Indigenous Peoples Health at the CIHR, and they have spent a lot of time, Carrie Bross is their director. They've spent a lot of time developing this plan, which was launched in 2019, and it's their health strategic plan, and it really was designed in consultation with full engagement of Indigenous communities and Indigenous stakeholders and researchers to come up with a way forward on how we can prioritize health research among these communities. And it takes us out to 2024, so it's very current. So this is right out of the document. It's available on the CIHR website. There's links there and there's PDFs you can download. But basically, you know, the Institute for Indigenous Peoples Health undertook a strategic planning process to set the goals and priorities of the research agenda as seen by Indigenous peoples. And in there, the director in her introduction quotes, changing the status quo requires introducing new knowledge and research paradigms that are based on Indigenous cultures, values, and beliefs, and that are respectful of traditional Indigenous knowledges and underpin the work ahead and the reason for being of the Institute for Indigenous Peoples Health. So these are their 4 strategic priorities. I'm not going to read them out. You can see them there. But in general, they are, and they state, you know, First Nations people, you know, Inuit, Métis, and communities to drive Indigenous health research and knowledge translation. They want to be part of the process, and they want to support research and innovation. And this has been my experience. If you do proper engagement with the communities and you set priorities with them, you can have an incredible experience and be very successful and have really, really important research outputs that can advance health of the communities. The third priority is to advance research beyond acknowledged notions of health equity and give primacy to wellness, strength, and resilience of First Nations, Inuit, and Métis people. So that's something that may not be in the front of your mind as a researcher, but this is one of the 4 strategic priorities. And also to encourage and champion Indigenous community based health research networks across Canada to develop capacity for First Nations, Inuit, and Métis health research and knowledge translation, which seems self-evident, but I'm really glad they put it in as one of their top 4 priorities. This is, they lay it out nicely. This is just a screenshot I took from what they lay out as a table of strategies, indicators, and expected outcomes. And they're pretty clear. So this is their strategic priority number 1. And they tell you what they list out, what they come together in this collective process as the strategies. And then what would be the indicators to show success of that and the expected outcomes. So for the first part, they have review and implement policies pertaining to institutional eligibility of Indigenous community organizations to administer CIHR research funds. The indicators would be increased number and diversity of Indigenous community organizations eligible to receive funds, and the expected outcome would be Indigenous health research capacity is strengthened, just as an example. So this is also out of the strategic planning document, but they state explicitly, ask Indigenous people how they view health and well-being, and they will describe a holistic approach, a striving for balance in the spiritual, physical, emotional, and mental health spheres of their self and their environment. And then they go on to say, if there is an imbalance in one or more areas, the individual strives to restore the balance by focusing attention of the required spheres, thereby returning to a place of balance. This worldview is qualitatively different than the Western approaches to health and research, which focus more on illness and something foreign in the body requiring treatment. And I picked these 2 out because I think they really speak to the fact that you may have your health research priorities in your mind, but it's really, really important to think about how the community, individuals in the community and as a whole, from their own Indigenous health perspectives, are seeing the notions of health and wellness and illness and interventions to improve health or reduce illness. And they may be quite different than yours. So they give this conceptual model. This is for Indigenous health and well-being, which I've seen before, you may have seen before, and it takes in the different spheres, spiritual, mental, emotional, physical, which all make up health and well-being or wellness at the center. And certainly we all, I think, function this way when we think about health and well-being among all of our patients and or within our research and the outcomes and the positive impacts that we're trying to achieve through our research. But you have to also think of people who are on the receiving end of your research and who have their own priorities. And you need to consider, this conceptual model or conceptual framework, if you will, as you approach the research. And that's really speaking to maybe more complex, multi-level, interventions and or implementation frameworks, but certainly something to consider. And then the key focus of the strategic plan, also I pulled this out, was really that to show you that the plan was developed with guidance from not only communities, but with elders and people who are considered knowledge holders in Canada. And they took into account, obviously, a rights-based approach, equity, and also took into consideration the Truth and Reconciliation Commission of Canada and their calls to action that came out of that relating to residential schools, et cetera. And then this is the CIHR Health Research Roadmap. So this is their second iteration of their roadmap, and it's capturing innovation to produce better health and healthcare for Canadians. This is speaking for all Canadians, but I put here the specific components which relate to Indigenous or Aboriginal people's health. This document, this roadmap, predates the one done specifically by the Institute for Indigenous Peoples' Health. But it talks about enhanced patient experience and outcomes through health innovation, health and wellness for Aboriginal peoples, a healthier future through preventive action, and improved quality of life for persons living with chronic conditions. So chronic conditions are definitely even listed there among this roadmap strategy. And this is taken from the strategic planning, the strategic research plans for the Institute for Indigenous Peoples' Health. But I thought it was really important to put it here because this speaks to all health research, but specifically it should be always front of mind when you're thinking about doing work within communities other than your own community, which you know best, but also especially among Indigenous people, which speaks to a set of values, which is respect, inclusiveness, integrity, transparency, ethics, collaboration, and accessibility. And they do come up with a common set of themes. And I think that these are themes that which can be considered even beyond Indigenous health research or remote or rural research, but they should be the themes that we also consider in all of our research with any populations we're working with that are different from our own. But specifically in this document, they talk about Indigenous self-determination, capacity development and infrastructure. They talk about Indigenous health research and histories are being acknowledged, which I've spoken to this before, and invigorate and sustain the CIHR network environments for Indigenous health model. And you all many of you who do research and have applied to CIHR may be aware of the network environments, of course. And then wanted to speak a little bit about how to disseminate research findings. Like, this is all kind of self-evident, you know, you do your research, you produce your results, you often feed it back to the participants and or the communities. Whether this is in Canada, this is very similar to what I do in other global settings, but really also, and you publish your paper ideally, and you present it at conferences or posters and those sorts of things. You might write a policy brief if you're trying to change guidelines based on the incredible outcomes you've had and the evidence that you've generated. But really what I wanted to make sure we mentioned is that you think about who actually owns the data. When you've worked in a rural, remote community, and especially within an Indigenous community, you have to think about the importance of how you're going to disseminate and understanding what will be the understanding of your research findings. And I put, you know, translation in the literal sense. Sure, your traditional ways of translating your research findings and disseminating them might be through a community presentation or a simple research brief done in lay language. But sometimes in Indigenous communities, the way that stories are told and the way that you might disseminate your research findings is through, they disseminate things through songs, through telling stories. And it may be that that's not the way that you would disseminate your findings, but you should take that into account and talk to community leaders and elders when you try to figure out how to get your research findings disseminated in the most appropriate way to the people who participated in your research. You need to think about what the meaning of the findings is. What's important to, sorry about the dogs, what's important to you, and what the findings mean to you may not be the way that the community or the individuals and the participants in your research see those findings. You have to be aware and try to understand all of the different possibilities and think about the applicability of the findings to the community. And also considering if you're say you've done a research study and your result's negative, like what you did didn't work. It's not a failure. You have to be sure that the community understands that they didn't fail. You know, they didn't fail, that the research, the intervention didn't work. But there's so many other things that you can learn from that research. Typically, if you're evaluating on different levels, you know, what I call a process evaluation, and understanding the fidelity of how your intervention was implemented. Maybe it wasn't actually implemented the way you thought it was, and that's why it didn't work. It still means it works, you know? So these sorts of things are really important to consider. And then we're almost getting there. I want to leave time for questions, but here's some guiding principles here. And they're all kind of self-evident. I felt kind of silly writing them down, but I thought I would anyway. But you have to think about things like co-planning, joint leadership at every stage of the research. You know what, you really, the most successful way beyond setting the research priorities, but also when you've engaged with the community and you know what, you all agree on what you want to do, it's really imperative that you have someone at the community level, in whatever context we're speaking of, involved in the joint leadership of the project. Not that they're involved necessarily in the research itself. They're not trained researchers, but that they are aware at all times of what's happening, and even assisting with implementation and decision-making right from the beginning of developing the program up through the ethics and through the dissemination. It's good to write it down sometimes so everybody knows what expectations are. What are the rules of engagement? I think this is really, really, really important, and letting your stakeholders guide you through this. Like I work in rural communities in Africa. I usually make it a point of having the regional medical officer of health, who essentially works directly under the president, as a co-investigator. And they're involved every step of the way, and I don't do anything without their permission. It can be very similar working in an Indigenous community or in a remote rural community that has Indigenous and non-Indigenous people in it. And how do you navigate that? You have to think about ongoing vertical and horizontal communication, and having problems solving and doing it as soon as the problems are arising through the process in a very iterative way, and changing course if you need to. That happens all the time. Priorities do change, and sometimes you need to tweak things to make them work, to ensure fidelity of how you're implementing your intervention, for sure. And then you need to think about all activities of the project being transparent. How will you ensure all your stakeholders understand exactly what you're trying to accomplish, so that at no point anyone feels like something's being done that they somehow didn't know about. This can be from a safety perspective, but on all levels. Who's being enrolled, and ensure that adequate financial and other resources are available. And this should be front of mind and be discussed up front. People don't do things for free, and you need to know how you're going to navigate and negotiate that, and look for guidance to the people you're working with. Last few things here: follow community values and timeframes. Remember at all times that as academic researchers, we're actually guests in the community, and always remember that, and be humble. Strive for highest standards of productivity and ethical behavior. And academic researchers need to seek consultation from community leaders about cultural sensitivity and cultural safety. And you must understand that our own learning needs to appropriately engage in the research through our own understanding of the historical and social context of the community. So what I'm trying to say there is that you need to check yourself and make sure that you fully understand the history that's gone on behind research, whether it's in one community, a group of communities, a population, and make sure, and also understand how you yourself feel. There takes a little bit of inside reflection at times to remain culturally sensitive, culturally safe, and to build the most optimal resource partnerships with the people that you'll be working with. And that's really all I had to say today. I'm speaking from, I would say, from multiple contexts, because I work not only with Indigenous communities in Canada, which have also non-Indigenous people in them who've participated in my research, but I work with Indigenous communities on a global scale, which are quite different, but some of the legacies of colonization and previous researchers undoing the wrongs of previous researchers are definitely still there. And I have to work very hard at all times at making sure I'm fully aware of my own behaviors and making sure I'm always trying to consider not only the health research priorities of the people that I think I'm trying to improve the health of, but I also how I'm perceived at all times, and how I can best, fully develop and implement a program so that, when I walk away, I've done something good and not something either just neutral or negative. Because why use resources and time and people's time? You really, the ultimate is always to try to have something good come out of it. Maybe even if your intervention that you were evaluating didn't work, there's so many other positive outcomes that can come out of having these types of research relationships. So I'll stop there.